we do have a while to go yet. However, within 10 sessions, considering you came with a diagnosis of complex PTSD, is really incredible. Think about it. Because I know when I first met Alison, she was very anxious and she would rock a lot as I was talking. And I noticed that you don't do that anymore.
I didn't know I did it.
Yeah,
I really didn't.
And now you don't, because I think it was just an anxiety.
Mm-hmm.
So neurofeedback has really helped, to calm all of that down. It's like it takes the pressure off you to feel you've got to perform in some way or do homework or come in and talk to me about things. It's easier because you just come in, you look at the video and it calms you down and it helps you with anxiety, depression and everything you've talked about and regulating your emotions. So life doesn't feel as difficult anymore or as threatening anymore. And all you're doing is looking at a video for 1 hour with me, just making sure the frequency is right for you. So it's not painful at all. There's nothing from the sensors and it's quite comfortable. And when you're in a session, do you feel yourself starting to relax and calm down in that hour? You can literally
yes.
To calm down in that hour.
Mm-hmm. Most definitely. And it's a calmness that I don't think I have ever been able to access. It's really lovely. And to be able to feel getting up in the morning, you can actually make your breakfast and be cheerful. Not tearful, cheerful, which is most unusual. First of all, it has changed my life. And that sounds a sort of a bit of a naff thing to say, but it has. Because I'm not living in fear, and I'm not living in happiness and the feeling that something awful is going to happen. And I'm on the way to being able to have friendships. And it's been so lonely, been so cut off from other people and thought I wasn't wanted. So to feel accepted by other people and know that they care about me and they're my friends is wonderful. It really is. And it's going to get better as I go through this. I can see the future in this.
Perfect.
And you, Harry, you're living with me.
I was a short paragraph.
Sorry.
No. My life has changed for me when she is well. At the moment, we're not there the whole time. We're still going in and out of problems. But the effect of the neurofeedback has become really absolutely obvious. There's nothing else it could have been. That's better. Even if she does flip, it's going to be resolved. It's almost certainly going to be resolved pretty quickly. She comes out and she cannot really understand the way she was just 20 minutes ago.
Well, I can see it now because I come around. Regulate is the word you used on. I do. My brain does seem to stabilize, and I can feel myself calming down and not believing the awful things I was believing and not feeling the awful things. And then sometimes I feel guilty and have to apologize to Harry for being so angry and aggressive. But I do. It does. It stabilizes itself.
So we're restoring your brain, as the book says.
Yes, you are.
Yes. Mm-hmm. Yes.
I think some people would think, you couldn't watch a video and have it change the way you feel. I think that would stop people. But then I would argue, when you go to the cinema and you watch a film, you can come out terrorized or crying or having laughed your socks off. So watching and listening to things have an amazing effect on us. And so I don't see why a system can't be set up to create particular effects in the brain and make the brain do all the things that it didn't do before because it didn't know how. And I think the other thing I want to point out is the support that I get from you, Dawn, because it's very, very high level of support. And it's not just that I see you once a week and go away as if I've been to the dentist. I email you, as I've been asked to do, during the 48 hours. I give a sort of record of how I'm feeling, how I'm reacting, all sorts of things. And you've said to me, email anytime you've got a question. And I know you're there. And I know that if I send you an email, you will answer it. And that's tremendous because what happens happened to me in the past was you'd walk away from having your psychology and then that would be you and the person completely separated all over again when you're not good at with relationships. And you've kept me close and safe while this is going on. So I think maybe somebody would think, well, there's no human contact in neurofeedback. Well, there is. There's a lot of human contact in it.
Yeah.
And we talk as well in the session, at the beginnings of it, in the end.
Yeah.
We talk. And you show me the results on the graph and explain things that have been going on. So I regard it as very safe and comfortable, and generally just a kind process that I'm going through.